Ka Bethany Hospital Shillong mentagas ngi laipau trik ulebe aja R4R kala Plie ka jaka ajing sumar ka banungkong ka balatip kum ka Center for Reproductive Medicine and Infertility Hashilong ban yarap ya ki longkmie ki ba omla ban armet nipun ya ikon kane ka long kum shibenta jong ka jing rakhe ya ka jing dap arpus nem jong ka ni ka hospital ka jing bamla ban armet nipun khon ka de ka wei ne ki jing ka babun ba ki shijur ki ju ya kindo pat ha ka perthei baro ka wei la ong kumba nreupo hado prapo million ki shijur ki badang de ha karta kha ban pun ki yakindo yakini ki jing nakine kumba kha san million ki de ki shijur ki bha India laong u Dr. Batiston D1 ba obade u consultant and infertility specialist ha ka bakran ha ka nigas ngi Plie u Dr. Batiston u laong ru bakat kumba kalong hadu menta kinu ki shijur ki banaka jila megalia ki hap ban sa be haki jaka sumar shagohati baduna ya kalai banai bat kala ban long hadu hnriu ni kendai banai hi bat kani ka kta ba ya kito ki baduna ka kamai ka kaji ulo ong ru ba ka daw jong ka jingla ban armet kanang duna kat bakarta jong ka longkmie kanang he kumta kani ka center kan yara ban penyo ya ki shijur ya ka jing sumar ka bade biang banwan ra ya ka jing kemen shaka long yeng jongki ya kani ka center la Plie da ikong RM kurba bade ka secretary of health but ikong isawanda lalu deputy commissioner jongka East Khasil district ikong kurba ai laong bakani ka santa kanyara mi kilong yeng ki badon kam ya ki bukum kini ki jing sumar angni hapo jongka dongba haka jaka bakin le sha sumar shabar ka jila bat jingai na layeng ikong lalu ila ai kuble ek hospital bat ka team ka bel shimkhia banwan ra ek ni ka jing sumar ka bakarpang na ka banta ki shijur ke biya kindu jing haka kha kapun
who have experienced the situation, how they have gone, not only in Guwahati, they've gone all over to Delhi, Madras, Chennai. It's like madness chasing after, care and to get this, to have a child, to be exact. So what happened is at this point of time, where we are, having a child naturally also is very, we all know how it is, There's a lot of kind of uncertainty for a mother. But then, being a mother, it's something which, it gives a lot of hope. It gives a lot of purpose. Therefore, I understand the stress that goes through a family which doesn't get pregnant naturally. Therefore, in this situation, as we gathered here today to open the Center of Reproductive Medicine, I really congratulate the hospital administration for coming up with the center to help our people to overcome this gap. It is indeed a gap for the state of Meghalaya, where, as we've said, that our people need to go outside of the state. And in this present situation, where we fear to travel, where we are still uncertain whether, going out is the right step to take. So people have been prolonging, to take this very important step in their lives. So I really thank the administration here in Bethany Hospital to have come up with this concept.
Infertility is defined as the inability to conceive following 1 year of unprotected sexual intercourse. It is an established fact that the infertility affects 15% of couples in the reproductive age group. In America, the quoted numbers are 1 in 8 couples have trouble achieving pregnancy. In a recent study that was published just last week in America, they have quoted that 2/3 of military families report challenges with family building. Unfortunately, infertility or subfertility in the country of India has not got the importance it deserves due to a lack of data. We all know that the ability of a couple to achieve pregnancy decreases with the increasing age of the female partner. Witnessing a significant rise in the late marriages in the 21st century, the prevalence of infertility is said to be witnessing an increasing trend. Of the 60 to 80 million couples worldwide suffering from infertility, a rough estimate of at least 15 to 20 million of these couples are in India, which translates to a rough estimate of about 25%. With infertility, the term infertility stigma refers to a phenomenon associated with various psychological and social tensions associated with the couple, especially to the woman. I therefore urge the society to play a positive role amongst the infertile couples.
Congratulate the hospital management, the doctors, the staff, the entire team for this commendable initiative, which is indeed a very welcome step, as has been laid out in the presentation by Dr. Patterson just now, towards providing fertility treatment of quality standards within the reach of every individual. I also wish to congratulate the hospital on the momentous milestone attained by it this year. It has completed 20 years of service to the people of Meghalaya with its trademark care, commitment and compassion. And I wish to place on record our extreme gratitude from the side of the district administration to the hospital for its continued support, particularly during the COVID-19 pandemic and our vaccination efforts as well. Thank you so much once again. It is a matter of great pride for all of us that this centre is being launched on the 50th year of Meghalaya's statehood, when the entire state is poised towards making greater strides in improving the overall development of its people, improving the quality of life for every individual, and most importantly in health, including maternal and reproductive health. As we know, in the past 2 years, a spotlight had been thrown on the high number of maternal and newborn deaths in the state during the COVID-19 pandemic. Allow me to dwell a little bit on this. Even as efforts are being made to ensure the availability of essential public health services to the last mile, the state health policy has been launched. We also recognize that there are other very important factors in the context of Meghalaya that need to be addressed in tandem. Amongst them are social factors, the strength of community participation, poverty and other economic factors, deeply entrenched beliefs and faith-based convictions that deeply impact the response to public health interventions. In the context